All right, welcome everybody. I am Dr. Sergey Terrio with Alchemy Chiropractic. I'm a chiropractor here in Falmouth, Maine, and I'm here with.
Becky Longacre. I'm a nurse gun health coach.
And today we're going to be talking about treating effects versus the root cause. And I'm going to talk about how I got into chiropractic specifically, some of the things that I've seen, some of the questions that I had on my way to being a chiropractor, and in general, just healing in general, how the human body works and how healing actually works. So, Becky will, of course, speak on her behalf of what she's seen in and around the idea of treating effects versus the root cause. So, in today's society, we have a lot of professionals and everyone from healers like Reiki healers, acupuncturists, massage therapists, chiropractors, medical doctors, doctors of osteopathy, which are more like medical doctors nowadays. And I would say the primary population goes towards more of the allopathic route, which is the medical route. So anytime somebody has some type of symptom or ailment, we're not talking about surgery related or broken bone related or a burst appendix or bursting appendix. We're talking about things that are, I would say, common for an imbalanced body, like neck pain, digestive issues, blood pressure imbalances. They usually typically go to a medical doctor, like an ER or a hospital, and the first thing, at least in my experience, that I hear is they get some type of form of treatment, whether it's you're okay, it'll get better on its own, or some type of muscle relaxer or some type of drug. And if that doesn't get better, then usually it goes to a form of surgery, or let's do something cut out or put into the body to hopefully fix this issue. So I saw this growing up, and of course we all see our family members going through certain symptoms and through certain diseases and certain health challenges. And I think, especially me, I was wondering, well, how come some people are really healthy and some people are not so healthy? How come some people in their 80s, they say they feel like they're in their 20s and 30s, and some people in their 20s say they feel like they're in their 80s and 90s?
Mm-hmm.
And that was the biggest question, and just seeing that as a kid. And I remember being 10 or 12 and really just even asking these questions before I even knew how to form thoughts, really. And I remember wanting to go into school with that question in mind and wanting to be a medical doctor, because I think that's just what we're brought up with in this world. And that slowly transitioned from being a medical doctor to wanting to work with people a little bit more hands-on, to the point where in my undergraduate career, I was trying to get into a internship, and just everyone was busy and couldn't get me in. And this one chiropractor I was actually suggested to said, "Oh yeah, I'm busy, but you can come in. You can come and shadow for your credits." And I had no idea about chiropractic. I had no really idea about holistic healing in that sense. But when I went, I just noticed that this guy who was a chiropractor, people would come to him with migraine headaches, with all this type of ailments, and they would walk in with sunglasses, and then they would get adjusted and they would walk out feeling 100% better. So I'm like, well, that's cool. I want to do that. And so that started my path of what we'll call holistic healing, and transitioning from seeing people and wondering how come one person is healthy and happy, and how come all these people have diseases or symptoms, to asking the questions, well, how does healing actually work? What's the mechanism behind it? And so I got into chiropractic school. I learned about anatomy and the physiology and how the human body works on a physical level. And then I started asking, well, if chiropractic really works, how come acupuncture works? How come acupuncture has sealed everything under the sun? How come homeopathy has been around for a while, healed everything under the sun? How come Reiki. Reiki is a healing modality. And I got introduced to something that I do call the zones now, just on a physical level and technique level, but really learning about the healing principles, which I'll get into a little bit later. So I started really diving into the history of medicine and healing. And the questions that I was asking were along those lines of, how does healing work? How come chiropractic works? How come acupuncture works? How come somebody heals from, we'll say, diseases that modern medicine says are incurable, and they end up having, God forbid, stage 4 cancer, to all of a sudden being totally fine, just totally fine. Or somebody being in a wheelchair saying they're not being able to walk at all, and they do something and they're able to walk and be totally healthy. So I started looking at the history of medicine, and one of the things that I noticed was, and just an example, in the mid 1950s and 40s, somewhere around in the 1940s, early 1900s to mid 1900s, one of the cures for asthma actually had all these concoctions in it. And actually, by the way, before I say, this actually worked. People took this and it worked. Like, they had asthma, they took it, it was prescribed by a medical doctor, and their breathing got better. And this concoction consisted of a few ingredients. One of them included, actually the main ingredient was the hair of a hanged man. So somebody that died by hanging. Sorry, this was in the 1800s when this was, not 1900s, the 1800s. But this was the hair of a man that was hanged to death, and they said that this is what actually did the cure. And of course, now we're sitting here, we're laughing about it, because it's like, how can that actually be the cure to that? But it worked. Now, you can see in history there are different things that people believed, and there are things nowadays that work that I'm sure in 100 years we'll be laughing at. One of the cures for depression back in, actually now I'll say the 1950s, was a lobotomy. Mm-hmm. Lobotomy was a common practice. Mm-hmm. Now we're sitting here in 1950s is a lot closer than 1800s, but like, how the heck did they do that? And even closer to history, there was something called Carter's little liver pills. And they're supposed to, I think, improve your digestion. They're liver pills. They're supposed to help your liver, and symptoms that go along with that. And basically, when the medical association started to, form their rules and laws, they basically said, you guys got to take away some of the things that you're saying for legal reasons. You can't name it Carter's little liver pills. You have to, or take out some of the things or change your formula. But these pills were working for people. And as soon as they took one of the things out, it stopped working for people. So, but the ingredients, there was nothing fancy about them. So that really just sparked wondering how healing actually works. And of course, the approach to healing, as you look through history, one of the things that a lot of things come up with is faith. So like, people just having faith. And I would say equally as important, the concepts behind certain things. Christian Science is another thing that has healed everything under the sun. And Christian Scientists, I'm not religious, I'm not telling for anyone to be religious, but you go to a Christian Scientist and they say, you are God, God is everywhere, you can heal, and they've healed everything under the sun. So somebody that's not religious, they're going to say, that's not going to work. That's just not going to work for them. Somebody, of course, is religious. They're going to go to that, and that will most likely work, as history shows. So in the idea of treating effects versus treating the root cause, we have to look at what really does the healing. And the effects, masking the effects, just giving drugs or giving some type of allopathic route, I'm sure, in a short period might make people feel better, but getting to the root cause and knowing how the body actually functions obviously goes a long way. With that being said, transitioning into the physical aspect of the body now, 10 times out of 10, if I had to put my money on something, it would be in an imbalanced body versus a balanced body. 10 times out of 10, a balanced body will do what it needs to do to heal mentally, physically, emotionally, and otherwise. So when getting down to the root cause, there's, of course, as I mentioned, many steps. One can go and get acupuncture. One can go and get chiropractic care. One can start with nutrition and the laws of the body and moving their body. And with balancing the body, if you could see this backdrop behind me, there are zones of the body. So on the physical basis, when the body's in harmony, when the glands of the body are in harmony, on the upper left there, the glands regulate all the hormones of the body. So the mood, the energy, the sleep, it's the body's internal pharmaceuticals. It takes care of everything, including skin, hair, nails, and reproductive function. The eliminative zone is the part of the body that controls all the eliminative functions. So if you ever think of like allergies, right? Somebody that's maybe allergic to anything and everything, their body may not be eliminating toxins properly, but when it is eliminating toxins properly through the lungs, through the breathing, through the intestines and the kidneys, you can expect proper breathing, proper immune function, proper, during the allergy season, proper breathing. Zone 3 is the nervous system. So this is all the nerves of the body and where the nerves go that regulate energy levels and head and eyesight and hearing and brain function. The fourth one right here is the digestive function. Pretty self-explanatory. One of actually the symptoms that I see and we see with a digestive system that's not regulating properly is not being able to digest foods that are normally able to be digested. For example, like dairy, gluten even. Another example just comes to mind, random examples. Some people can't eat like red marinara sauce, right? Or red peppers, but we all know people that can eat that stuff. So balancing the digestive zone, having a stomach that works properly, can digest and eliminate that stuff properly. The fifth one is muscles. So this is strength, flexibility, movement, stability, posture, and balance. And then the sixth one is circulation. So this is, again, a no-brainer. If there is high or low blood pressure, if there is an overactive thyroid or underactive thyroid, lymphatic drainage, and cardiovascular health, one of the other things that we see is like temperature regulation. So if somebody's too hot or too cold, this will, of course, help balance the body. And there's a way to balance the body on a physical level that will take care of a lot of these things. Now, in closing, addressing the root cause of the body rather than the effects, we have to see that effects may come very quickly in terms of symptoms. I'm going to say symptoms. They may appear quickly or they may appear over time. But when balancing the root cause of the body and balancing the body, we can expect that these symptoms, whether they came on quickly or slowly, will either one by one or altogether disappear. And when you address the root cause, it's not about adding something or taking something away. It's about normalizing. So normalizing, bringing the body back to normal. And when you address the root cause, that's what we're doing. Health is not a state that we achieve or try to get to. It's a state, it's the normal state of the body. So in doing these methods, it's all about bringing the body back to normal, just back to normal. And when the body's back to normal, it knows what to do to self-regulate itself and function properly and healthy and happy. So I'm going to introduce Becky here. As she mentioned, she's a health coach, and she's a nurse health coach and health transformers, and she will talk about some of her own personal journey as well as what she sees on the aspect of treating effects versus the root cause.
Thank you, Dr. Terrio, for having me. So when I hear that people were healed by, in part, the hair of a hanged man, that brings me to truly understand the power of the mind in terms of the healing process. And that's pretty profound in terms of the body being able to heal itself. You can visualize healing and then produce healing from your mind. You can talk to your body. I have that experience myself. So I'm going to ask the audience who is rewatching this video, and to our audience here, how many of you know someone who has more than one health condition? Most people. Most people know someone that has more than one health condition. For me, it was ulcerative colitis, back pain, anxiety, and weight gain. When I went to my medical doctor, he saw that these things were separate. From his point of view, they were all separate. They were not interconnected. They did not have the same or similar root causes. When I was in my 20s, I was on 5 different medications to manage these various issues. And while I was not sick enough to be in the hospital, I was not the vibrant, healthy person I am today. So I wasn't sick enough to get into the hospital, but I was not healthy. In my 20s, I started making some lifestyle changes to improve my health and wellness. I stopped drinking alcohol and started doing yoga and meditation, for example. And I started to get healthier in certain aspects of my life, but I hadn't really established all the things that the human mind, body, and soul need to be healthy and thrive. When I was in my 30s, I started to change the way I ate to heal ulcerative colitis. This was very effective in terms of healing the gut lining, but I hadn't fully addressed my stress management issues, and working as a nurse through the pandemic made me realize this pretty acutely. Though I had started to do yoga, meditate, and change my diet, I had put on over 30 pounds of fat after having my son. I was consistently injuring my back as a bedside nurse, and when the pandemic hit, my anxiety went through the roof. The pieces of health that I had started to put together were shattered, and all of these seemingly unrelated health issues came back during the pandemic. Back pain, fast weight gain, anxiety, and ulcerative colitis. In the midst of struggle, there's always opportunity, and I chose to listen to what the lesson was. I had to take better care of my body in order to reach a better state of health. So being the researcher that I am, being the nurse that I am, being the stubborn person that does not accept defeat that I am, I started to look at the common denominators of health. In the hospital, I looked at the patients who tended to get better. I looked at my own successes and studied why I tended to get better with various issues. I researched the literature on certain health behaviors and put self-care back on the priority list. The result was pretty profound. I stopped flaring with ulcerative colitis. My anxiety was managed better. I healed back pain, and I lost 30 pounds initially. Since opening my health coaching business, I have lost 10 additional pounds of vanity weight. And all told, I got off these 5 different prescription medications that I was on, and I stayed healthy after getting off of these medications. So the common denominator of all these seemingly unrelated conditions was self-care. What does self-care mean? It means I give my body, mind and soul, all the things that it needs in order to heal and thrive and be healthy. Not to just stay out of the hospital, but to be healthy. So the health behaviors that I focus on, that I've researched, that I've experienced, that I've observed in patients that tend to get better are getting enough sleep and resting the brain through meditation throughout the day, hydration, drinking enough water, healthy eating that makes sense for you, healthy exercise that makes sense for you, having a supportive community, having spirituality and joy, and getting outside into nature. What I've learned after years of suffering is this pretty simple fact. If you take care of your body will take care of you. If you give your body resources, time, and space to heal, it will get better in a lot of cases. I don't like to use absolutes, and I don't know anyone's particular situation, so I use most cases as sort of a blanket statement, because most of our chronic illnesses are results from deficiencies in one or more of these health behaviors. I do want to acknowledge, however, there are chronic, genetic conditions that do play a part that are independent of health and lifestyle changes. And I want to acknowledge that for people that are, suffering from a genetic cancer, for example. I am not anti-medication. If I were to flare with ulcerative colitis, I would go back on medications to control the flare, but it's the healthy lifestyle that keeps me away from a flare. The healthy lifestyle decreases the chances that I will flare. It doesn't bring my chances completely down to zero because there are genetic components to this illness. So for my talk, I'm going to be focusing on weight gain, anxiety, and high blood pressure. These are the most common health conditions that we have in America, and many of you know somebody that has this problem. So to effectively treat weight gain, anxiety, and high blood pressure, it's crucial to understand the underlying causes. These conditions often stem from complex interactions between biological, psychological, and social factors. Weight gain can be caused by a variety of factors, such as poor diet, consuming crappy, high-quality, low-nutrient foods, fast food, sugary drinks, all contribute to weight loss. Most people that I've worked with underestimate the amount of calories that they're taking in. Physical inactivity. A sedentary lifestyle with little to no exercise can lead to weight gain as the body stores unused calories as fat. Most of the people that I've worked with exaggerate their calorie use in the form of exercise. Genetics can play a role. Some of us just naturally have slower metabolisms. Medications, such as antidepressants, antipsychotics, corticosteroids can all lead to weight gain. Medical conditions such as hypothyroidism and polycystic ovarian syndrome can cause weight gain. Stress and emotional factors. Stress, anxiety, depression can lead to overeating, and that contributes to weight gain. Lack of sleep. Inadequate sleep can disrupt hormones that regulate hunger and appetite, leading to increased food intake and weight gain. I harp on sleep because most of us are not getting enough sleep. That's the truth. Most people are not sleeping enough. This is a crucial foundation in mental health, i.e. anxiety management, and also physical health, i.e. it helps with weight loss and reduces blood pressure. As people age, their metabolism slows down, so that's just a fact. As your friendly neighborhood health coach, I can teach you techniques to jumpstart your metabolism that will help you to lose weight. So in order to lose weight, maintaining a balanced diet is very helpful. So a balanced diet is going to look different for someone that's flaring with ulcerative colitis versus someone that has diabetes versus someone that is trying to heal from having a heart attack. Engage in regular physical activity that works for you specifically. Generally speaking, though, Harvard Medical School recommends 4 components of physical activity: cardiovascular, strength training, balance, and stretching. All comprehensive and holistic ways of working out. Manage your stress. So practice stress reduction techniques such as mindfulness, yoga, and meditation. Give yourself breaks throughout the day, not just food breaks, but mental breaks to rest your brain throughout the day. Get enough sleep. Aim for 8 hours of quality sleep per night for overall health and weight management. And stay hydrated. Drink plenty of water throughout the day to maintain bodily functions. Water is also absorbed in the food that you've already eaten, which expands your stomach, which sends the brain the signal, I am full. So you'll consume less calories if you drink more water overall. So anxiety disorders, the next topic, multifaceted. They can result from genetic predispositions, neurochemical changes, and then environmental stressors. Chronic anxiety can lead to problems such as blood pressure increases and weight gain. So hopefully we're all seeing that this is all very much connected. How we take care of our body can impact many different health issues. Anxiety disorders are widespread and can stem from a variety of factors. The most common causes are environmental stresses, such as financial, relationship, health, workplace. These all are things that can trigger anxiety. Stressors often create a sense of uncertainty and lack of control, which can exacerbate feelings of anxiety. So many of us also go throughout the day. We do not stop. We do not take a break. By doing this all day, every day, you're teaching your nervous system to always be in the fight or flight phase or mode. If you force yourself to slow down, if you force yourself to take a break and even meditate, you're teaching your nervous system it's okay to go back into that chill, relaxed state of mind. So throughout the day, give yourself extra time to complete things. Allow for buffer time in between tasks. Exaggerate how long it's going to take you to complete something because you know you're going to run into hiccups and human factors are going to apply. You may think that this is not efficient to do buffer time. A lot of people think that initially. But when you mindfully plan your tasks throughout the day, it's a lot more efficient than going, running on empty, making mistakes and doing tasks that are not actually moving you forward. Another thing that's tremendously helpful for people with anxiety is to focus on the things that you can control versus the things that you cannot control. When you do this, your world suddenly becomes a lot more manageable because you truly understand you cannot control anything outside yourself. This gives you tremendous power in your life, actually. When you can't control the weather, but you can dress for it, that allows you to go anywhere as long as you dress properly, as long as you prepare for it. Traumatic experiences are a huge root cause factor as to anxiety disorders and other psychiatric illnesses. PTSD is linked with a lot of anxiety disorders, trauma in childhood, or other sorts of trauma like car accidents and violence and things like that are linked with anxiety disorders. So many people who have been abused as children, for example, will go into adulthood with emotional overeating because subconsciously they're trying to protect themselves from the predators. So you'll have people lose weight and people will start to say that they're attractive and that makes them feel bad because they were hurt as a child, and so they'll gain weight again to protect themselves. So that's one example of treating the trauma in childhood as opposed to looking at the calorie intake, calorie output. The misuse of drugs and alcohol can cause and exacerbate anxiety. Substance abuse alters the brain chemistry. So high blood pressure is often the result of lifestyle factors like poor diet, lack of exercise, and chronic stress. So you've heard me say stress 3 times in 3 different health conditions. Chronic stress is a major factor in a lot of our issues. High blood pressure is a common condition that can lead to serious health issues if left untreated, like heart attack or stroke. The most prevalent reasons include excessive intake of salt and saturated fats. Additionally, sedentary lifestyle makes blood pressure worse, and chronic stress factor in high blood pressure. Consistent exposure to stress can lead to prolonged activation of the body's fight or flight response. So again, the fight or flight nervous system, the sympathetic nervous system is in charge, which increases your blood pressure. So the doctor might prescribe you a blood pressure medication, and really the problem is you need to take care of your stress. Genetic factors also play a role in high blood pressure, and then underlying health conditions such as kidney disease, hormonal diseases can make blood pressure worse, and so it's most helpful to focus on the kidney disease as opposed to the blood pressure disease if you want to fix the problem. So, and also aging, so the older that we are, the less elastic our vessels are, and so that sets you up for more blood pressure in general as you age. So, look at your stress, look at your activity level, look at your diet, look at your sleep. If you look at those 4 things, your health is going to improve by a lot. Proper nutrition is fundamental in managing weight, anxiety, and blood pressure. A balanced diet, rich in whole, real foods, fruits, vegetables, lean proteins, and healthy fats can help regulate body weight, stabilize mood, and maintain blood pressure levels. Physical activity is beneficial for everything, including perception of pain, reducing blood pressure, reducing weight, and helping with mental health challenges. You can also, incorporate other things like cognitive behavioral therapy, which is looking at your core belief about the world and how that helps to shape anxiety or helps to calm you down. So my core belief might be the world is an unsafe place. And so I'm finding all this evidence that's going to increase my anxiety, as opposed to I can do things to make myself safe, which has the effect of lowering my anxiety. So like I said, I'm not anti-medications, but we can do a lot more in our health and wellness lifestyle changes to improve our health and wellness before we start getting prescribed a whole bunch of pills. I'm living proof of that. I'm getting off of 5 different medications and still staying healthy after getting off of these medications. So thank you for joining me in this important health discussion. It's very important that we talk about the root cause of illness as opposed to just treating the symptoms. So I hand it back to Dr. Terrio.
Yeah, that was awesome and very helpful tips. So yeah, that wraps up with everything, and you can see a common theme around here is an image goes a long way. The mind is very powerful in what it does as well, but the mind and body are one, really. They play off each other. The mind will affect the body and the body will affect the mind. So if you take care of the body, it'll take care of the mind. If you take care of the mind, it'll take care of the body. And so why not take care of both? And it sounds like there's plenty of methods and plenty of people to reach out to for help if you need help with those things. And again, thank you for Becky for coming by, and thank you for all of you coming here. We're going to do a Q&A. If you have any questions, leave them down in the comments below, and Becky can sure answer them.
Yeah. Yep. Awesome. Does anyone